Women are diagnosed with breast cancer every single year, and some of them will be fortunate enough to catch it early.
So October Breast Cancer Awareness Month, as you probably heard, Dr. Clarence Lee from US Healthworks is here with important health reminders for women. Nice to have you here.
Thanks for having me. Good morning.
Has there been anything new in terms of a reminder, something where you're really trying to reel people in? Is there a change in age for detection?
Well, the most important thing is for a woman to know her risk, her risk stratification. So if she's normal risk, which is what 85% of the women are going to be, they're going to start mammograms around 40.
Okay.
The most important thing until then is to do your self-breast exams and have a clinical breast exam every 2 to 3 years.
Let's talk about early detection. I don't share this too often, but I'm fairly young. I'm in my low 30s, and when I was in my 20s, I actually found several lumps in my breast, and it was because I was taught about early detection and feeling almost like a pebble underneath your skin. What are some other signs that the average person can look for?
As long as a woman is doing self-breast exams regularly, she should be able to notice changes. And so that could be a lump or pain or any sort of discharge from the nipple. The most important thing is to make sure you're comfortable with how your breasts normally are, so you are able to notice a change if something does.
And it seems like it can just sort of pop up at any point. That's kind of how it was for me. I have a lot of friends the same way. Do you notice that a lot, where people are normal 1 month and then the next month something sort of pops up?
If they're regularly doing their exams, absolutely. Yeah, that's the most important thing. If you're doing it more and more, you're comfortable and you're able to notice a change early, and that's the awareness piece.
Now, doctor, you mentioned 85% of women, which would be normal, age of 40 mammogram. What about family history, where you have a mother, grandmother, or something like that that had breast cancer?
Yes.
How much sooner do you recommend?
So that's something that the person should have a conversation with their provider. So that's going to be very individual based. So if it's a gene mutation that they have, or if it's family history or prior history of cancer themselves, that's something you want to make sure you're talking about with your provider.
Now, we know October is Breast Cancer Awareness Month. We always talk about women, but men can get breast cancer too. Is it the same symptoms for men as it is for women?
Similar symptoms. It's about 1% of the cases found in men, so this isn't just a women's issue. This is everyone's issue. So yes, absolutely, it's found in men.
I remember doing an interview with Richard Roundtree, who played in the movie Shaft, and Richard, a very famous actor, was advocating for men to detect because he did get breast cancer, and he said there's a bit of a stigma about that. It's a very low number of men that do get it.
Yes.
What should I be doing? Is it the same symptoms?
Same symptoms. As long as you're when you're in the shower, and notice anything different, you want to make sure you bring that up with the provider and not just sweep it under the rug.
Would it be pain first? Generally, would you feel some pain before you feel a lump?
Potentially, you might not feel pain first. You might just feel different in the contour, but it may be pain. But any sort of difference, the most important thing is to make sure you're open and bring that up with your provider.
I have a question. So for me, in my case, and this is very specific, I felt the lump. I went to a doctor. I was told it was nothing. I actually went with my gut feeling because, again, I know my body, and I had a second opinion, and instantly they said that's a lump. Do you see that a lot, where maybe one doctor notices it and another not, because lumps are hard to detect?
Yeah, so if you have to make sure you continue to reiterate that, and I'm glad that you did kind of go with your gut and make sure you keep bringing it up. The woman is the most, or whoever, the patient is the closest person to the issue, so they're going to have the most information.
And it seems like too, when you're kind of feeling around, you can feel a lot of lumps that are natural lumps. So it's hard to distinguish what a potential cancerous lump would be compared to an average sort of lumpy of maybe fatty tissue. Is it right?
Yes, yes. So depending on your age, you may have more dense tissue. Younger women will have more dense breast tissue. So as long as you're having that conversation, having a clinical exam with your physician regularly, you can prevent things from going further.
Right. Dr. Clarence Lee, US Healthworks. Doctor, thank you.
Thank you.
Good spirited conversation today. Amy, thank you.